chart the way forward on the network's advocacy. So in this second program on civil society advocacy around drug policy in West Africa, we want to use this edition to begin a very critical and important conversation on and around two things. First, the implications of a transformation of the erstwhile Narcotics Control Board, because I'm sure many of you may recall that the Narcotics Control Board was dissolved around the Nayele issue a couple of weeks ago, actually a couple of months ago, but many of you may not know that the Narcotics Control Board is now going to become a Narcotics Control Commission. Now, we're not quite sure what that augurs for the treatment of those who are hooked onto drugs, because there are a lot of articles in there, in the bill that is going to Parliament, which suggests that it's quite still maintaining the repressive line of the war on drugs, and therefore giving a bad deal to, let's put it, the small fish who need to be treated through different eyes and different lens, as increasingly one becomes aware that the war on drugs should actually be replaced for a different campaign in which we look at the issue of drug policy as more of a public health issue as well. So it's no surprise, therefore, that we have three members of the network here today, advocates of the newly established West Africa Drug Policy Network, who believe that the bill still sustains the older impressive focus of the war on drugs, targeting the small fish by imposing long and harsh sentences on them, in place of treating them as addicts in need of assistance by clinicians, psychologists, and public health professionals. I beg your pardon. Second, the network's call, the second issue we're looking at is the network's call on members of the public and CSOs to actually support the call to what they call support, not punish, drug users, with an equally urgent call for a holistic review of the bill before ratification by Parliament. It's for this reason that we have Maria Goretti-Ann, who's a barrister and solicitor and the regional consultant of the International Drug Policy Consortium in the UK here. We have Mohammed A. Adamu, who's founder and CEO of WAPAM Foundation. And we have Christian Lion Loco, who's a public relations officer of an organization called REMA that helps reformed addicts. They'll all be telling us a little bit about themselves and what their institutions do. And so welcome all of you to African Focus, and welcome to the studios of Radio XYZ.
Thank you.
Thank you
very much for the opportunity.
Thank you for your patience. We're running a little bit late, but I know that we're still going to have a discussion as insightful as we would have.
Thank
so,
you.
I guess we should start off a little with introductions. Each of you can give us 2-minute introductions about yourself and your organization. So we're going to start with you, Maria.
Yeah, my name is Maria Goretti. I'm a lawyer by practice, and I am also the African consultant for IDPC, which stands for International Drug Policy Consortium, based in London. IDPC is a global network of about 130 NGOs that focuses on issues related to drug production, trafficking, and use. What IDPC basically does is that it promotes objective and open debate on the effectiveness and direction and content of drug policies at the national and international level. IDPC also supports an evidence-based policy that are effective at reducing drug-related harms. Our advocacy positions are based on 5 core policies, and they are we produce briefing papers, dissemination key resources on drug policies. We try to build the capacity of our members and partners and offer expert advice on policy making and officials around the world. Thank you.
Great, thank you, Margaret.
Thank you. My name is Mohammed Adamu. I'm a dual diagnosis specialist and the founder and chief executive of WABAM Ghana, which is an affiliate of MBAM UK. MBAM UK is the Ethnic Minority Behavioral Health, Addiction and Recovery Management Foundation. And we work with ethnic minorities in the United Kingdom, in hospitals and in the community. Out of this work came the fact that we were noticing a large proportion of ethnic minorities in mental health hospitals while they were not turning up in drug services. And we had a huge number of ethnic minority, mainly people from West Africa, sending their kids, family, wards back to West Africa because of drug problems in Europe.
They were sending them back?
Yes, wow. Because of drug problems in Europe, thinking that Africa is safer and things are better here. Well, unfortunately, or fortunately, the WACD, that's the West African Commission on Drug, has done a very, very thorough job in producing this document that drug is no longer in transit in West Africa. We're no longer a transit countries, a group of transit countries. We are now actually a user country, and there seem to be ongoing problems around management of drug use in West Africa, not just Ghana. So that gave us the initiative to set up with the West Africa Behavioral Health, Addiction and Recovery Management Service to provide support for people with a drug dependency, who are either abusing or dependent on substances, including alcohol, and provide them with the preparation before they go into rehab, and then work with them as well when they come out of rehab, which is what, during our needs analysis, we find out is lacking in Ghana especially, as most of the facilities we have here are mainly residential rehabilitations, but there are some work to be done on individuals before entering rehabilitations and exiting rehabilitation, and then reintegrating them back into the community on skills development. So that's mainly what we do in WABAM.
Wow, thank you very much for that. And Mr. Loco,
thank you for having me on your program.
Okay.
My name is Christian Lion Loco. I'm the, like you said, the public relations officer of REMA Ghana. REMA is actually an acronym signifying Rehabilitation of the Marginalized. It's actually an international charitable organization in over 70 countries worldwide, with the focus on helping those on the margins of society. We help street children, orphans, but basically we are also into the rehabilitation of drug addicts, alcoholics, and ex-convicts. Suffice it to say, I am a rehabilitated ex-addict. I think, from the way I should say it, I was into drugs from school, secondary school, precisely. I was drinking alcohol excessively and abusing marijuana, and then, unfortunately, after graduating from Cape Coast University with a first class in English and a diploma in education, I got hooked on hard drugs. I became an addict to cocaine and heroin, and it was really, really, really distressing and a very, very harrowing moment of my life. In fact, I had very, 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 very unpleasant experiences. But then, by the grace of God, I went to REMA for rehabilitation, and I've been there for about 6+ years now. And I mean, there's been a great and a major turnaround in my life. And I wish to always use my experience, which is not mine alone, but the experiences of many others like me, to bring on board this drug issue. That is, to support and not to punish. Drug addicts are not criminals. They are just patients. They are just people with an addiction problem. Just like you're talking about Ebola. There are people with health issues who need to be helped and not to be criminalized. Thank you.
Thank you very much for that, Christian. Thank you very much for each of you, your candid and concise introduction of yourselves. It's important to remember that there's a lot of stigma around drugs, reformed addicts, and so on. So it's very refreshing to have someone like you, who is here to help out. And you should encourage a lot of other people to feel free as well, because that's why one of the reasons why the network is around to ensure that, we have turned the apple cart on the old narratives in any case. So
it took lots of guts.
Yes,
but I'm proud. I'm proud to be here because basically that is what the network is about.
Exactly.
Fantastic. So I guess we should really ask the most important question: why should anyone really care that narcotics board has been dissolved and there's a new narcotics commission? So what the average Ghanaian may want to ask: why is that analysis therefore important in your
view? Before I respond to that statement, I want to make some few references to some few issues that have come over. On the platform for discussion over the years. You all bear with me that, as Adamu has mentioned earlier, that West Africa has not just become a transit zone, we have become a consumer zone as well as a production zone. That means that we have a number of these drugs that are transiting the zone, staying in our country or in West Africa, in this sub-region, and then citizens will definitely have to consume it. Now, with this issue, the drug issue has become a problem. And since the declaration on the war on drugs by President Nixon over 40 years ago, you all bear with me that we haven't been able to have a drug-free society. Drugs are still a problem. Now, if you look globally over the years, the laws that have been implemented or being used over the years to address the issue of drugs, they are very repressive in nature. We have done this over years, and yet we still have a huge number of people who are hooked to drugs, meaning that you can tell from all these that have happened over the years that there isn't any relationship between the repressive nature of drugs and drug use. We have repressive laws, yet we still have a huge number of people who are hooked on drugs. And what we should be looking at now is, have we been able to make a change by these repressive laws? No, we haven't been able to, because there are huge numbers of people who are still using drugs. That means that the methods we are using, the procedure, the way we are doing things, it's not working. And once you are doing something and it's not working, that means that you need to sit back and see if I need to take other strategies to be able to address the problem. That is the main reason why we are here today. And we think that with this new bill that is coming up, as against the law that we have currently in this country, that is the PNDC law 236, if you look at the two, this law has been repressive enough. However, if you look at the bill that is before us, it is harsher than what we have presently. Now, we civil society are of the view that if these laws have been repressive enough, and yet we are not seeing results, we are seeing the worst aspect of things, why don't we look at it again as the recommendations that have been made by the West Africa Commission on Drugs, that we need to treat drug use as a public health issue and not a criminal justice issue. That is the main reason why we need to engage our governments. We need to engage our policy makers on the table to open up the debate and analyze issues and see the way forward and see where we can have a balancing act. We cannot just be doing things one way. We need to look at the two sides, demand reduction strategies. We need to look at the supply reduction strategies and see how we can marry all these things, and then we have a better solution to the problem.
Thank you very much for that discussion. You wanted to add something to that?
Yes, I just want to specifically, the question you asked about the why the general population should care about what happens to NACO board if it's going to be a commission or if it's going to remain a board. Well, I think in the first instance, if you take, this is just my own opinion and a wild guess, if you take about 10 Ghanaians family, you will be surprised that we will have almost 3 or 2 out of those 10 families, you have people in that family with an alcohol or a drug problem. So, and this has a social impact. It has, apart from a health impact, has a social impact on employment, on productivity, on family cohesion, even on where there is a kind of endemic drug use. It brings down the cost of property around that area, affecting other people's business. So Ghanaians should be concerned, one, because of the health issue that comes with it, your wards, husband, partner, children getting infected or being addicted and getting all these kind of prolific illnesses that comes with drug use. Now, that is why the Ghanaian population needs to be interested. Now, what is the remit of the National Control Board as it is now? And what will be the remit of the National Control Board as a commission? Now, what we want to understand is, for the general population, the NACO board, I'll just break it down, its remit should really be what we call supply reduction, ensuring that the quantity of drugs coming into our shores is remarkably reduced. I'm not sure it can be eradicated completely, but it can be reduced with efficiency on the part of the department in the NACO board that handles supply reduction. Now, why we are here is because of the lack of, and with the supply reduction, there's been a lot of support for NACO board, with the supply reduction around the international support, war on drugs, funneling in money and then helping them. Now, what is not clear for our network is the role of NACO board in demand reduction. You know, what strategy have they in place to see that people from the street using drugs goes through the treatment pathways and come out at the other end a productive citizen, tax-paying citizen, and a proud member of our communities? Now, that is what is missing. And that is what we want, this new commission. We don't want a situation where it will be an old wine in a new bottle. We want a situation where this new commission will have a human face. We really look at each Ghanaian citizen in a respectful and appreciative way, and look at Ghanaian family, and look at our society, and see how we can prevent drug use damaging our families and communities. Without the narcotic board being a very effective service, if it transfers the same pattern into the commission, then our network is going to be worried, because so far there has been issues. My colleague Marie Goretin has the experience, I've had the experience. The responsiveness of the current narcotic board could be better, and the kind of work they are doing around demand reduction is not up to scratch. We need to work with the wider community, so civil societies, with our network. We're happy to. We're not against or castigating any organization or the government. We want the government to come and collaborate with us and see what is best for one, Ghana, the citizens, families, and especially the drug users that we are concerned about. These are the most vulnerable people that could impact on our health. We can tell if we choose not to do anything or do much. I'll just mention Mexico, and I'm sure a lot of picture will go around in people's mind. So,
yeah, definitely. I can imagine. But of course, it's important to give that background of what Mexico has become. Maybe you can tell us a little bit about what happened in Mexico.
All right.
With this so-called war on drugs.
Yeah.
How successful they've been or not.
Well, unfortunately, it's not just Mexico. It includes most of the South American countries where the United States, kind of extend their policy on war on drugs. But I'm glad to say the United States is rethinking their own policies and their strategy around tackling drugs, because what they did before was criminalize drug use and gave countries money to fight from a criminal crime perspective instead of from a public health perspective. Now, over the years, Mexico has been inundated, and some other South American countries, Guatemala, for example, gang violence fueled by drug use is massive. Majority of not Caribbean countries, South American countries. And now this is the violence, because once you create a market where there are individuals available to buy these commodities, these drugs, and use them, and they get addicted, and because of the addiction, they then commit what we call trigger offenses to get money to buy their drugs. So we send them to prison, they stay in prison, which is overcrowded already, which has poor facilities to help them, and then we get them released back into the community, and once they are in the community, there is no structure in place to guide them through within the community. So now this then creates a pool, an increasing pool of drug users whom the barons and the cartels then have a market. We are creating a market for them. So once we create this market, then the drug users or the drug users then is what I think in law, my colleague here is a lawyer, so I know there's something called double jeopardy when you try someone twice, or is it something like that? Our drug users then suffer double persecution. The drug sellers persecute them by getting them addicted, poor quality of life, destroy families, destroy individuals. They are suffering that. They cannot get any assistance for that addiction to get them through how to say no. And the government then comes in and says, okay, that is not enough punishment for you. I'm sending you to jail. And then send you to jail for a couple of years. And now, when we come to the